Almost good afternoon. Let's talk all about the piriformis, okay? And piriformis is a real pain in the you-know-what because of where it sits and where it lies. And the main thing that I want to come away from this video is that what is the piriformis? Kind of where does it sit? What can it cause as far as pain? And then 2 stretches that you might be able to try and recreate at home. Obviously, if there's pain with them, don't do that. These are just suggestions. And if you do have questions, definitely hit us up. We can definitely answer them in the clinic as well. But let's start off with, if I can do this, the piriformis here. And I'm going to pop this up here and make it bigger. The piriformis is what we're looking at. It sits deep to the glute muscles. And if we're looking, here's the back of the pelvis, and kind of down there, right as we highlight it here, is going to be the piriformis. And that guy basically substitutes for the glutes when it doesn't perform enough. So if you have some glute participation issues, you'll probably see the piriformis be increased in tension because it's trying to do too much. Because of that, that can create irritability within the muscle itself, or it can affect the tissues around it. And so let's talk about that a little bit. If we have irritability in the muscle itself, you have these white X's are trigger points. The red is where they refer. So you might see some lateral hip pain, what we might often call bursitis. But you see kind of this focal, all those little red dots. That's where people felt pain. And so you could have kind of, broad hip or glute pain, as well as pain down the back of the leg, which often will mimic what people say, hey, it's coming from the low back, it's sciatica, we have pain there. If we look a little deeper here, we have the piriformis, and it straddles the sciatic nerve. That yellow thing is to the sciatic nerve. So imagine if that is tight and putting pressure on that, you might get symptoms down the sciatic nerve, much like you would if you had a disc issue. So piriformis syndrome is what they call it on the interweb, can often mimic sciatica. And so you'll have people that get pain back of the thigh, back of the calf, even into the foot, because their hips are too tight or because the piriformis is too tight as well. So definitely something to look out for. What we want to do is then figure out, okay, if we think we have piriformis syndrome, the big things that I want to figure out is, okay, do your symptoms change when you change your back position? So if you lean forward, does it change? Do you lean backward if it changes? Because those sorts of things will allude to maybe more of a spinal component versus piriformis component. But most spine components come with some hip tightness. So these next 2 stretches I'm going to talk about are very, very useful regardless. But again, if they aggravate your symptoms, don't do it. If they cause pain, let's not do it. Let's talk to a professional first, okay? So if we're looking at other stretches, we'll pop this guy up. This is a very, very common piriformis stretch. Seated, super easy. The only thing I don't like about this picture is the guy's kind of rounding his spine. What I would prefer is you sit up nice and tall, cross one ankle over the knee, and then just literally lean your torso forward as if you're trying to put your belly button through the hole that your leg creates in that figure 4 type position. You should get a pretty good stretch in your hip and maybe back your thigh a little bit. Most stretches I will recommend holding for at least 30 seconds up to a minute, but usually not more than that. Other one you might do if you're tolerant to kneeling on the floor is what we call a pigeon pose. You get on your hands and knees, pull one leg underneath, you can kind of sit back into it. Again, you're going to get a nice little stretch into the hip, but this is a little more demanding as far as pressure. So you might not be there yet. And it does put a little pressure on the knees. So you got to be cautious of that if you have sensitive knees as well. So in summary, we got the brief hip limitations, piriformis limitations. We've got the piriformis syndrome going on. If you have issues with that, let us know. We'd love to talk to you about it. And if you obviously have any questions, message us, email us, contact us on the social media, and we'll go from there. Hope you guys have a great day. Talk to you later.